Hi, good afternoon. My name is Jennifer Downs, and I'm here at Lee County Health and Rehab today to present to you my project. In the capacity of a student from Columbus State University, I am presenting my capstone project for the RN to BSN program. The project that I have decided to do research on is the use of probiotics for prevention of hospital-acquired Clostridium difficile infections. Clostridium difficile infection, CDI, commonly called C. diff, has become the leading healthcare-associated infection in the United States. Although there have been advancements in the diagnosis of CDI and various treatments have been developed, preventative strategies have yet to be determined successful in reducing CDI rates. The major risk factor for CDI is the disruption of the normally protective gastrointestinal microbiota, typically by the use of antibiotics. New research shows specific probiotic use may be a prevention tool for CDI among hospitalized patients. Patients typically taking 2 or more antibiotics and in settings where the risk of CDI is greater than 5%. My research will discuss the literature available on the use of probiotics for the prevention of CDI. Like I said, despite the advances in the diagnosis and treatment of C. diff, prevention of CDI remains a challenge. CDI has become the most widely reported healthcare-associated infection, accounting for almost 500,000 cases per year. Symptoms of CDI range from mild diarrhea to severe colitis, severe abdominal cramping, fever, increased white blood count, and consequences of CDI include prolonged healthcare stays, 24% higher hospital readmission rates, increased risk of other nosocomial infections, higher mortality rates, and higher healthcare associated costs. The human digestive tract is home to over 500 species of microorganisms. Normal flora help with digestion and absorption of nutrients, as well as enhance immunity from infectious agents. Risk factors for C. diff include antibiotic use. We know in the hospital you usually take a lot of antibiotics through mostly your entire stay, and there are certain antibiotics which are at higher risk. Clindamycin, fluoroquinolones, those type of antibiotics. Risk factors also include hospitalization or long-term care facilities like we're at today. Healthcare workers are at a higher risk, advanced age over 65, suppression of stomach acids if you're on a PPI. A lot of people in the hospital are on proton pump inhibitors to prevent other gastric problems. Chemotherapy or immunosuppressed patients, and gastrointestinal tract manipulation, such as tube feedings if you have a PEG tube or if you've had some kind of gastro surgery. The rationale for this project was, according to the Center for Disease Control and Prevention, CDI is an urgent threat, necessitating a prioritization of public health resources to determine infection and restrict transmission. This project topic was chosen because C. diff is the most frequently reported healthcare-associated infection in the United States. A Center for Disease Control and Prevention surveillance study found that CDI caused almost 500,000 infections and directly led to approximately 15,000 deaths in 1 year alone, mainly in patients over 65, and they are also related to higher healthcare costs, estimating $4.8 billion for acute care facilities alone. C. diff infections have received a lot of media and medical attention over the past several years. In accordance, many hospitals have implemented strict protocols and preventive bundles. such as hand hygiene guidelines or when it is acceptable or not acceptable for nurses to send down stool samples. You don't want to send down a formed stool sample because that is not C. diff. And we will get in trouble if we send down a stool sample that is colonized with C. diff, but the patient doesn't actually have the actual infection. Due to the nature of this resilient organism, all evidence-based preventative measures should be considered. One preventative measure that is not used often enough in the prevention of CDI is combining probiotics with antibiotics in order to improve growth and cultivation in the host. The combination of probiotics, Bacillus clausii and Lactobacillus reuteri, secrete compounds that directly inhibit the growth of C. diff spores. And that's what we want to do. That is what we want to accomplish. Hand hygiene is very important in preventing the spread of C. diff. And we all know this, but alcohol-based hand sanitizers do not kill the spores. You must wash your hands with soap and water for at least 20 seconds. And it is known that bacteria can live on surfaces such as the bed rails, walls, toilets, toilet seats, the countertops, anywhere, for months, which makes it very hard to get rid of the infection altogether. And it has to be cleaned with bleach products. The room also has to be sanitized by EVS or Planox. When a patient is discharged, they have to go over the whole entire room with a black light to make sure all the spores have been killed. The question that I wanted to answer is, in hospitalized patients, what is the effect of timely use probiotics on the reduction of Clostridium difficile infections? There isn't evidence for change. With C. diff being a critical and pressing problem around the world, the CDC is working in conjunction with the Centers for Medicare and Medicaid Services and other federal partners to reduce C. diff infections by approximately 30% by 2020. Many people, including patients from the hospital, inpatient rehab facilities, skilled nursing facilities, they would all be educated on the understanding and relationships between antibiotics and the microbiota. The microbiota is the natural germs in our bodies that break down food to release energy and produce vitamins. Antibiotics can disrupt the healthy flora and cause an unbalance of the microbiota, causing C. diff to grow out of control, causing symptoms ranging from mild diarrhea and stomach cramping to severe cases of 15 episodes of foul-smelling, explosive, watery diarrhea per day, colitis, toxic megacolon, and even death. There have been a number of advances in probiotics and understanding of their role in prevention of CDI, but a number of important safety and efficacy questions still remain. Sorry, getting a little tongue-tied there. The literature review was conducted. I searched several databases, including Medline, PubMed, Ovid, CDC, and the World Health Organization. The terms I used to search were Clostridium difficile, CDI and probiotics, probiotics for prevention of C. diff, and prevention of CDI. The purpose of this meta-analysis is to report findings from available studies that evaluate the efficacy of probiotics administered to hospitalized adults in the prevention of CDI. A comprehensive, systematic search was conducted to identify all relevant studies. Results revealed that administration of probiotics led to statistically significant relative risk reduction of 71% for CDI, which supports the potential role of probiotics to favorably influence the mechanisms that is responsible for antibiotic-associated diarrhea and possibly C. diff. One case that I wanted to talk about in particular was in 2013. There was an observational study published in the Journal of Clinical Infectious Disease. The study took place over 10 years, beginning in 2004 through 2015. In 2003, a 284-bed community hospital in Quebec experienced a major outbreak of CDI. They recognized that hospitals in surrounding areas also had a high incidence of CDI, which were 5.7 cases per 1,000 patient admissions in 2001, which increased to 28.2 CDI cases per 1,000 admissions in 2003. So after an initial 6-month observational period that showed apparent ineffectiveness of the current standard preventative measures alone, they added a probiotic bundle. Beginning in January 2004, every inpatient adult on antibiotics without any exclusions was started on a probiotic called BioK within 12 hours of the antibiotic prescription. Subjects were given 2 capsules per day, all of which were 100 billion CFU, which are colony-forming units, and probiotics were continued for 5 days post-antibiotic discontinuation. During the 10 years of observation, 44,835 inpatients received BioK. During those 10 years of observation, all the patients that received the BioK, data was published annually and was expressed as cases per 10,000 patient days. The average annual incidence rate of CDI remained at values much lower than those observed in conglomerate of other Quebec network hospitals. It was 2.3 versus 7.5. These values were also lower than those from equivalent hospitals. Their rates were about 8.3 cases per 10,000 patient days. The CDI rate declined from 19 cases per 10,000 patient days and remained at low-mean levels of 2.3 cases per 10,000 days. This 10-year intervention resulted in a 73% reduction of CDI cases in this instance alone. Understanding the microbiota and infections are connected in the future. Let me start over on this one, I'm sorry. Understanding how the microbiota and infections are connected is the future of protecting the public's health. As the field of probiotics continues to expand in the United States, so does the need for clinicians to be aware of probiotic use. To aid in providing the best patient care, clinicians should be cognizant of the fact that hospital-acquired infections can be very emotionally and physically stressful on the patient. Additionally, the economic costs attached to the hospital-acquired infections is looked upon negatively for the facility. Hospital-acquired infections, such as CDI, increase the patient's length of stay, limit hospital reimbursement, and increase the hospital's infection rate. This is the probiotic BioK. It's specifically formulated Lactobacillus acidophilus, Lactococci, and Lactobacillus rhamnosus. It's been marketed since 1996. It is considered safe, and clinical efficacy is in various therapeutic applications. Previous studies have shown that this formulation effectively prevents CDI in patient-level randomized controlled trials. I believe that this specific probiotic formulation should be added to infection control bundles with new facility-level intervention studies for primary prevention of CDI. There must be a strong motivation to change in order to successfully introduce new practices. Providing information valuable and relevant enough to change clinical practices would be a successful evaluation. The reduction of C. diff would also be considered a success. Data may also be gathered about the cost savings and the reduction of CDI cases and the cost savings of discontinuing unnecessary antibiotics. The success of appropriate nursing education and getting clinicians and leadership on board would prove the successfulness of this project as well. Expected outcomes. Research shows that the use of probiotics is consistently advantageous to patients in the prevention of primary CDI. No single intervention alone will be sufficient to effect major changes in CDI. Vassallo and Goldstein recommended a bundle approach that includes environmental decontamination, the cleaning of all surfaces in the rooms, hand hygiene, antimicrobial stewardship, discontinuing unnecessary antibiotics, and along with those, also adding probiotics. The findings from the meta-analysis and comprehensive systematic search suggest that there is evidence on the effectiveness of probiotics to prevent primary CDI, particularly among hospitalized patients taking 2 or more antibiotics. And then I have several references also. Thank you all very much.
I think it was like 16 minutes.